I'm Joyce Cantoja, first-year nursing student at Central Mindanao University, and today I am going to demonstrate the procedure called assessing respirations. And before we can proceed with the procedure, we're going to do an assessment, which is to assess the respirations per minute, and the possible nursing diagnosis is number 1, fast irregular respirations, number 2, slow irregular respirations, and the materials that we're going to need in this procedure is gloves. And now, we're ready? Let's start with the procedure. I already wear my gloves, so now let's proceed with the procedure number 1. While your fingers are still in the place for the pulse measurement, after counting the pulse rate, observe the patient's respirations to count the RPM of the patient without voluntarily breathing. So you wouldn't tell your patients that you're counting their breathing because they will alter it or change the way they breathe. Okay, so now let's proceed with the procedure number 2. Note the rise and fall of the patient's chest. You can just by looking at their chest, or do it in the side so that they wouldn't be uncomfortable. So this is to count the respiration cycle. For the procedure number 3, using a watch with a second hand, count the number of respirations for 30 seconds. And after counting it, you need to multiply it by 2 to calculate the respiratory rate per minute. And now we're going to start counting.
What a wonderful world.
After 1 minute, we got 7 breathing. So you need to multiply it by 2. We got 14. So that means the patient has normal breathing, since the number of breathings that are normal ranges from 12 to 20 breaths per minute. Procedure number 4, if respirations are abnormal in any way, count the respiration for at least 1 full minute. And this is to count the respiration cycle for a minute and to assess the patient if it is irregular, if it has irregular breathing. But since my patient has regular breathing, we will note the depth and rhythm of the respirations for further assessment of the patient. So on how she raises her chest and lowers her chest. For procedure number 6, when measurement is completed, remove gloves. Since I wear gloves, I'm going to remove it and perform hand hygiene after that. I'm going to throw these gloves first. And we're going to perform hand hygiene. And after that, you can help the patient to put her in a comfortable position as she lies down on her bed. This is to ensure the comfort of the patient is being prioritized. And for the last procedure, procedure number 7, you need to remove additional PPE if you use one. And since I didn't use one, I'm not gonna remove anything and perform hand hygiene. And I already did it. This is to reduce the risk of infection. And that ends our video for today. Thank you for watching.